3 episodes of sclerotherapy done elsewhere, 1 surgery where they done the excision.
She's also had a hemangioma in the cheek region, which was operated.
एक मिनट
This is just before we start. You can see the size of the lesion. The kid is about 5.5 years old. This hemangioma excision, and I've made a small reconstruction from inside. Important thing is we've removed most of this lesion without causing. Hello.
Nice to say hi to you too.
Hi. Dede.
I've seen sir you today.
Come here. Okay. So this sweetheart has come all the way from Assam. Okay. Open your mouth, Baba. Yeah, she can understand very good English. Bite, bite, bite. So I'm just checking if it's a high flow one. It's extending all the way up to the angle. Most likely the main feeder is from the facial. Open your mouth, Papa. Open. Okay. So you've already had sclerotherapy
And surgery.
Okay.
In Satra Hospital, Bangalore, sir.
Okay. But did you have a surgery?
Yes, because sir, this is the inside also there.
Uh-huh.
So that time she was 1.5 years old. So the teeth is coming. So 2 times bleeding happened. So immediately we are very confused. So directly we got some.
Yeah, they have said excision of hemangioma done 2 years ago.
Yes,
But it's still there.
it's still there.
So we will be able to correct it for you. Don't worry.
Yes, sir. That's it.
And
Because sir, that time sir, I searched so many things, but this is my mistake. I don't know, sir. I am not getting your link, sir. 2019, sir.
no problem. So we'll start now. So what we generally do is for hemangioma patients, because it's a pretty big one for a small kid. So we'll keep the blood, everything ready. You don't have to worry for anything. I will try not to give any scar on the outside of the face.
Okay.
What I can correct is the size of the lip and the shape of the face we can correct.
Yes.
But I cannot correct the color. So she's having little color here, blue.
Yes.
I sometimes we cannot get rid of that color fully. You understand?
Yes.
Color जा नहीं सकता sometimes पूरा. ये lip का shape हो जाएगा सही, मतलब खून भी नहीं आएगा आपको, टेंशन नहीं, पहले जैसे आपको ब्लीडिंग होता था वो सब बंद हो जाएगा, पर कभी कभी कलर रहता है वैसे ही. That is something I cannot, it might improve. It will not get worse, but sometimes I cannot clear the color. So if the color is remaining, we have to look at some options later on when she grows.
Yes.
But at the moment, we won't be able to address that. बाकी सब रेडी हो जाएगा. ये चीक तक करेंगे अंदर तक, तभी ये जो सूजन है ये कम होगा, लिप भी हो जाएगा एक ही बारे में.
So कलर सर में बोला थोड़ा बड़ा होने के बाद
बड़ा होने के बाद भी ना वो कलर थोड़ा मुश्किल होता है पेशेंट्स को पूरा निकालने के लिए. कोई पेशेंट को नहीं निकाल पाते कलर, तो इसीलिए हम बता रहे हैं आपको फर्स्ट कलर के बाद. But of course, yeah, I know, but we will, once the shape looks good and the face, lips and cheek look good, no, color you can easily hide with cosmetics. कुछ भी हो सकता है आराम से. It's not going to be looking so obvious. Okay? You know Hindi or you know English or you know both or you don't know both?
Hindi.
हिंदी मालूम है? कौन सी स्कूल में पढ़ते हो? LKG. क्या करने वाले हम अब यहाँ पे?
She is also doing YouTube. So hi guys, good challenge.
Tell your name.
My name is Sharanya.
What's your father's name?
My father's name is Shudip Dev.
Why have you come here?
She knows. She knows this.
You're scared of me? No? Very good. We will try to do without any pain for you, okay? Okay? We will do some small magic and remove that. You like this or you don't like this? Tell me. You like it or you don't like
So
it?
sir, she's
Okay,
very
no.
strong. What I'm saying, she's going to school and some children are there.
Yeah, they are always
They
like this.
always, they are also children. They're saying, "How what happened?"
Ah.
She's coming and telling, but she don't at this moment.
Correct. That's okay. Let her. Just I'm asking her.
That's the
Some
reason.
children are so smart. They know. You know.
These
Even she will
children are
know.
Very smart.
Okay. So we'll इनका blood test कराना पूरा pediatrician.
No, pediatrician's coming here.
सर एक चीज से बोलना है कितना दिन चाहिए होगा सर so that we can book the return tickets and all.
1 week.
Flight tickets.
1 week
1 week means 7 days.
from the day of surgery.
From the
But I'm not sure if we'll do the surgery today or tomorrow.
okay.
We'll try to do today, but I'll let you know after the pediatrician also has a look at the child.
Tomorrow also no issues.
We'll try to do today. In that case, 1 week from today.
Okay.
So we have this very cute kid here with us. She's come a long way from Assam. She's had a few history with regards to treatment for this arteriovenous malformation or the hemangioma. 3 episodes of sclerotherapy done elsewhere, 1 surgery where they've done the excision. But you can see the lesion is still hanging out there. It's a low flow lesion. I just examined it clinically, very useful for me to feel the lesion, to know how it feels, to look for pleboliths, to see the pulsations, to feel it. So it's not a very high flow lesion, so we should be able to give her near perfect results. Plan is to do the procedure from inside that extends this much on the cheek, and the lip, of course, will be on the mucosal part of the lip so that there's no visible scar on the outside. Thank you. Right.
You stay here only.
Yes. At least mother has to stay. If you want, you can stay in the hotel.
So we have a luggage in also. That is the reason, sir. We cannot stay with the luggage here also.
No, they can give you a room.
Okay.
Better to stay here only.
So,
Because see, hemangioma, what happens? It is not very easy to remove fully. It can bleed even after surgery. So we have to monitor her.
yes.
That's why we are saying all this.
So plan today or tomorrow, sir.
We'll try.
Check out.
What time did she have food?
Not just taking juice. And
What time juice?
Half an hour back, sir.
So don't give anything now till the pediatrician comes and has a look at her. After that, we will tell you the time.
Sure. Exactly why it is coming? Because
Huh?
this hemangioma, how it's come from the.
How it comes.
I asked Bangalore doctor also, Dr. Anil Kumar. He also can't give proper reply.
It's very difficult to say. Only thing we know is when they are born, usually not there. After a few months or years, it comes and then it keeps growing till she grows.
Till she grows.
That is why it is better to do now and not wait till she becomes 14 or 15. It can become very big. If you see some of our videos, we've got very big hemangiomas. 10 days back, we have done a big hemangioma like this for an adult guy.
I have seen yesterday night also. I have seen that guy, sir, all hemangioma.
We do a lot of them. So the good thing is when you are young, it's easier to correct it for a lot of kids.
Yes, sir. Yes, sir.
So that's why. So
Myself Sudeep, I am from Assam, Guwahati. I came here for Richardson Hospital just 2 days back, and I got the information from YouTube internet. And really, whatever the seen in that search results, what are the published in the internet is really good. So I came here for my daughter treatment. My daughter is around 4 years 9 months old. She has a hemangioma, that is it's a blood tumor in her lips. So it started when she was born. After immediately born, we have not noticed. Almost after 1 month, we are seeing there's something blackish layer there in the half part of the lips and inside the cheeks. So there we thought what happened exactly, we don't know, but we consulted the doctor and doctor has told it's a hemangioma. So doctor has given that medicines called propanol. So we use propanol for 1.5 years, but it's not showing any results. The tumor increases, and then we have decided to go to Bangalore, or we have searched the internet. One hospital is there in Bangalore, is the Sakra World Hospital, and this is a very big renowned hospital in Bangalore. So we went there and met the doctor Anil Kumar and showing these things that propanol is not working. So doctor has told you do one MRIs and all. So we have done the MRIs for this baby. At that time she was 1.5 years old, and there doctor has told it's a vascular malformation. So it needs some another treatment like surgeries and all and sclerotherapy. So we have decided doctor will do that. So we have done that surgery that in Bangalore in 2019. And that surgery is done inside the cheeks, that part, hemangioma part that he has done, but lip part he has not touched. So and then followed sclerotherapy he has given, and he has told you come next year we will do another sclerotherapy. So this thing going on for last 2 to 3 years. 2001 also we have given the sclerotherapy, but nothing result happened. So then immediately I decided, I know this Dr. Richardson hospital. So immediately I decided to contact Dr. Richardson hospital, and I sent a mail to Richardson hospital and got a prompt response also. So doctors told like you come for the consultation. This is a small surgery is required for the correction. Everything will be fine. So this time I decided to come, and I came here, and my daughter's surgery is today, and I'm very hopeful that it will be successful.
Alright, so here we have this cutie with us, and she happens to have hemangioma of the lower lip, as you can see. So this is a low flow AV malformation, as that's what the MRI says. I swear. And there is persistent hemangioma of the lip, although this was not operated earlier, so this is going to be a primary surgery for the lip. We are going to perform a hemangioma excision, going to restore the shape of the lip to the normal symmetry as much as possible. And this baby is going to be with us for a period of 1 week when we start to remove the stitches, and once everything is off, she is good to go home. She's a very naughty kid. It's just that she's been starving for the past few hours. Otherwise she has a lot to say, and she's actually very jovial. आपने आज कब खाया था? नहीं खाया? सुबह खाया था ना आपने? नहीं खाया? जूस भी नहीं पिया? फ्रूट्स खाया था? हाँ, तो खाया ना? आपका नाम बता दो। नाम नहीं बताओगे? कितने अच्छे से कल बताए थे। No? Alright, I'm not going to disturb her a lot. Post-op, we will follow up with her and see all her naughty side. Yeah?
For this cutie in a while, she wants to go back actually. You won't have pain, okay? Without pain, we will do.
Yes.
See, this uncle inside, you will put something on your mask, mouth. Just breathe and you'll sleep. Alright?
She already done 3 times.
She knows.
Sclerotherapy.
3 times already she's undergone, right?
Yes.
So no worry.
2019, 20 and 21.
Oh my god, every year almost one.
Yes, 2 times sclerotherapy because 2 times anesthesia is required, and 2019 surgery.
Hopefully this will be the last time for
Yes, sir. I'm hoping that that's why I'm coming, sir.
Yeah, don't.
Oh, doctor.
एक मिनट
Hemangioma here on the patient's lower lip and cheek. We're going to be doing excision and some kind of reconstruction. This is just before we start. You can see the size of the lesion. The kid is about 5.5 years old. This hemangioma excision, and I've made a small reconstruction from inside the mouth. Most important thing is we've removed most of this lesion without causing any aesthetic issue for the patient. I'm going to show you how she looked before. So you can see the size of the lesion. This view. So you see a scar on the lateral aspect of the lip because that's the skin, and you remove the entire lesion of it. मिनिमम बट जब वो बड़ी हो जाएगी तब वो निकाल देंगे वो कोई ज्यादा ठीक नहीं रहेगा अभी भी दिखेगा नहीं आपको उसका
And sir, others marks also that
वो मैंने पहले ही बताया आपको कलर जाएगा नहीं
color नहीं that maybe marks I think
वो कलर ही है
color है
वो कलर नहीं जाएगा आपको शेप आ जाएगा सूजन भी नहीं रहेगा और अच्छा शेप भी रहेगा लेकिन वो जो ब्लू कलर है उसको पोर्ट वाइन स्टेन बोलते हैं तो वो जाएगा नहीं ओके वो रहेगा जो भी कलर रहेगा
This color.
but
हाँ ये जो कलर है
हाँ blue but red वाला चला जाएगा
रेड वाला मोस्टली चला जाएगा
okay
जो ब्लू है वो नहीं जाएगा
ठीक है सर कुछ भी जो
अच्छा ही रहेगा आपको बिल्कुल टेंशन मत लो
she looks good at least
you look fine don't worry sir and then there will be no bleeding अगर वो कुछ लगेगा जब
तो और कुछ सर्जरी चाहिए होगा इन फ्यूचर करेक्शन के लिए सर इफ आफ्टर 5 years
we will wait for some years 2-3 साल पहले तो nothing will be required if when she grows if there is any more thing that's happening you let us know then we can easily correct it
yes sir
if at all ठीक है
sure so sir when the stitch will remove tomorrow
yeah come tomorrow we will
yes sir at what time sir tomorrow
by 10 o'clock
you just tell me anytime
yeah 10 o'clock
we are only hotel
yeah you come by 10 o'clock
sure sir thank you sir
welcome
thank you sir bye 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 okay
ta-da